Hello, all doctors out there. Today we're going to study about stroke. Stroke means strike or blow. All of a sudden, people are struck by this illness. Did you know that every year more than 15 million people worldwide have a stroke? Of this, 5 million die and another 5 million are left disabled and 5 million are able to recover. Most stroke occurs in people over the age of 65 and they can occur in much younger people too. But what exactly the stroke is? As we know, the brain, like all parts of the body, needs oxygen, which it gets from the blood. As the stroke happens, when the blood flow is cut off to the brain. When the brain cells are starved of oxygen, they become damaged, and symptoms that follow are called stroke.
Looking at signs and symptoms of stroke, let's first study particularly which part of brain vessels does it affect. Let us look at the brain from an inferior view with its arterial supply. So crawling all from brainstem, we have the vertebral arteries, two of which them come from a subclavian artery. These vertebral arteries join to form basilar arteries which continue to crawl up the brainstem, up the pons and midbrain before basically bifurcating, and this will form circle around this region called circle of Willis, which gives off few branches. The posterior cerebral, the middle cerebral and an anterior cerebral artery. Joining the anterior cerebral arteries is the anterior communicating artery, and joining the middle and posterior cerebral arteries is posterior communicating artery. Strokes are put into two groups depending on the problem in the blood vessels supplying the brain. There can either be a blockage called an ischemic stroke or a bleed called an hemorrhagic stroke. The majority of the strokes are blockages. It's important to identify early on which sort of stroke has happened, as they each have very different treatments. Blockage strokes are commonly caused by buildup of fatty material in the blood vessels. This fatty buildup may lead to a clot which blocks the blood supply. It just like in a heart attack. This is why a stroke can be thought as of brain attack. Bleeding strokes happen when a blood vessel bursts suddenly, causing blood to leak in or around the brain. In these strokes, blood on the brain can lead to swelling, a serious problem which may require surgery in some cases. Sometimes, stroke symptoms completely disappear in less than 24 hours. This is called a mini stroke or TIA. A TIA is a warning sign that you are at high risk of having a full stroke. As we see description about circle of Willis, ischemic stroke occurs usually in middle cerebral arteries, while hemorrhagic stroke usually occurs in anterior and posterior cerebral communicating arteries and branches of middle cerebral and basilar artery.
Now let us see the signs and symptoms. As the brain controls the whole body, the symptoms of stroke can be wide-ranging depending on which part of the brain are affected. If the stroke occurs in this part of the brain, it would cause drooping face, here weakness in the arms or legs, or here difficulty in speaking. Other symptoms can also happen too, like change to vision, loss of balance, confusion, and memory loss. The effect might be barely noticeable, but are more often severe and disabling. Sometimes these changes can be reversed if treatment is started early. That's why it is important to act quickly if you suspect a stroke. Remember, you need to get help fast. That is, F is for face. Is their face drooping on one side? Can they smile? E is for arms. Is there weakness in the arms? Can they lift them both up? S is for speech. Is their speech slurred? T is for time. If you spot any of these signs, then it is time to call an ambulance. Once the ambulance arrives at the hospital, the doctor will assess you and arrange an urgent scan of the head, which shows where the brain is damaged and what type of stroke has happened.
The treatment plans. Emergency treatment with medications. In this, intravenous injection of tissue plasminogen activator, which is also known as TPA, may be given. And next, stroke rehabilitation is important. Rehab can be challenging, but many specialists are on hand to help alongside doctors and nurses. If your stroke causes difficulty swallowing, dietitians can recommend special diets or feeding tubes. If one has problems with communication, speech and language therapists can help. If it has become difficult to walk or perform daily tasks, physiotherapists and occupational therapists can offer after exercises and home adaptation. Also, after stroke, people often feel low or frustrated that they can't do the things they used to and don't like being dependent on others. Counselors can help talk through these feelings, and many patient groups are available for further support.
Preventive measures of stroke. Even if you have already had a stroke in the past, there are many small steps we can do to reduce our future risk of having a stroke, such as lowering of high BP, stopping smoking, lowering of cholesterol, being more active, eating healthily, lowering of alcohol limit within the recommended limits. If you have diabetes, keep control of blood sugar.
That's all we have about stroke. Thank you for watching.